HIDA scan, hepatobiliary immunodiacetic acid. So DTPA is pentaacetic, this one is diacetic. Hepatobiliary immunodiacetic acid scan is an imaging procedure used to diagnose the problems of the liver, gallbladder and bile ducts. It does not include the pancreatic ducts, but in case of MRCP, magnetic resonance cholangiopancreatography, so there is all the GB, liver and including the pancreatic duct, but here is not. It is also known as polyscintigraphy or hepatobiliary scintigraphy. What is the procedure? A radioactive tracer containing technetium-99 immunodiacetic acid analog commonly is injected into the vein of the patient. Then through the blood stream it goes to the liver, and bile producing cells take up the tracer and then travel with bile into the GB bile ducts to the small intestine. That is the flow steps. First vein, then liver to goes to the bile duct, then it goes to the GB, from GB it goes to the small intestine. A gamma camera tracks the flow of the tracer. What is the function of gamma camera? Is there any blockage or is there any abnormality that is it is used to trace? Is there any congenital anomalies or any obstruction that is used to assess? So gamma camera is used to track. And reconstruction in computer and image formation. What is the indication? Usually done to evaluate gallbladder, also used to look at the bile secretory function of liver and track the flow of the bile. HIDA can help in diagnosis of the GB inflammation, bile duct obstruction, congenital abnormalities like biliary atresia, post-operative complication that is bile leakage or fistulas, and assessment of the liver transplant. What is the adverse effect of the radioisotope? That is allergic reaction to the tracer, bruising at the injection site, and radiation hazard is also. What is contraindication? Same thing, history of allergy, lactation, pregnancy. Result of HIDA scan or interpretation: normal tracer moved freely with the bile from the liver to the gallbladder and small intestine. So liver, gallbladder and small intestine, if it is going through normally, then there is no problem, that is normal. If slow movement of the tracer indicates there is blockage or obstruction, it may be partial obstruction or complete obstruction of or it may be the problem in the liver, because if it is coming the low amount, then of course, because it is by the way it is going through substance, not by on, there must be the carrier. So it may be it is indicative of the blockage or obstruction, problem in the liver function. No radio tracer seen in the GB, it is indicative of the acute inflammation. Abnormally low GB ejection fraction, that is amount of tracer leaving the GB is very low, indicative of the chronic inflammation. There is no tracer, it means acute inflammation very minimal, it is indicative of chronic inflammation. If radio tracer detected in the other sites outside the biliary system, it is indicative of the leakage. So that's all about the HIDA scan.